When a dying person stops eating and drinking, how long does it usually take before they die? This is a question that I get asked all the time by families, and it is a really difficult question to answer specifically because it is going to vary person to person, disease to disease, and thinking about all of these questions. Have they completely stopped eating? Have they completely stopped drinking? Have they completely stopped with both? And when I mean completely stopped with fluid intake, I even mean things like ice chips. I mean small sips in their mouth. I also am talking about liquid medication. These things may or may not extend the dying process. If a person has stopped eating and drinking entirely, typically the average life expectancy is somewhere between days and weeks. Again, every person is different. Some people may actually eat or request something to eat the same day that they die. Remember, it is completely normal and natural for a dying person to stop eating and drinking. It's a natural part of the dying process and the body's shutting down process. The body is preparing for death. Food and fluid are no longer the body's priority and need. The person isn't dying because they are not eating or drinking. They are not eating and drinking because they are dying. It's recommended really not to force that person to eat or drink anything if they are not interested. The person will naturally lose that hunger. They lose their thirst sensation. If a person does say they're thirsty at the end of life, typically it's due to a really dry mouth. So keeping their mouth nice and moist can be really helpful. And just allow your dying person to be the guide. We don't have to force anything. If they're hungry or thirsty or want something, they will ask. My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. Follow me for more end-of-life education.